I'm sending the link to this video to the Eastern Area School Board and the Lehigh Valley Labor Council. As a former school board member and labor union official, I understand the constraints on their time and the amount of information and research they review each month. So I'm attaching links to information I found that asserts masks are not only ineffective in preventing the spread of a virus, but they also are petri dishes for other viral infections, as well as deprive the body of oxygen. Let's start with the impact of low oxygen levels. Here's a short clip from a recent video by Dr. Vernon Coleman. Dr. Coleman's a well-known physician in the UK. He's done numerous articles about the misinformation being spread about the COVID protocols. Here's what he has to say about masks.
Commentators in the mainstream media invariably stick to the official line that masks are valuable, and they rarely, if ever, even mention the clear and present dangers of covering your mouth and nose. And there's one hazard associated with mask wearing which has been totally ignored by the mainstream media: cancer. We know, without a shadow of doubt, that mask wearing results in low blood oxygen levels, hypoxia. Experiments have been done proving this to be true, and we also know that cancer thrives in a low oxygen environment. And so the inescapable conclusion must be that people who wear masks, particularly those who wear them for hours at a time, will be more likely to develop cancer. Moreover, individuals who have had cancer are more likely to suffer from metastases, a spread of their disease, if they wear a mask. This isn't a theory or a suggestion, it's an unarguable fact. Just check it out if you don't believe me. Just type cancer and oxygen levels into your search engine.
Since I'm retired and have the time, I Googled cancer and oxygen. Here's one of the top results. The links to the videos and articles referenced in this video will be included in the description box below. So I'm just going to read the highlighted portions. All animals and plants alike require oxygen, probably the most valuable nutrient needed by our body. In fact, nearly 2/3 of our body is oxygen. One thing that fuels various degenerative diseases is lack of oxygen. When the millions of cells that make up our body are deficient in oxygen, our health suffers. Adequate oxygen helps make the environment in the body more alkaline and less acidic. When our cells are low in oxygen, it causes our body to produce carbon monoxide. And that's not a good thing because carbon monoxide is acidic. Cancer and all diseases thrive in an acid environment. Cancer cells do not need oxygen. In fact, oxygen suppresses them, but normal cells need oxygen and lots of it. The research team analyzed data from 7 different cancer types: breast, kidney, liver, lung, ovary, pancreatic, and stomach, and found that even more important than genetic mutations, long-term lack of oxygen in cells may be a key driver in cancer growth. In 2015, the British Medical Journal published a paper entitled "A Cluster Randomized Trial of Cloth Masks Compared with Medical Masks in Healthcare Workers." The study, which was extensive, concluded that the results caution against the use of cloth masks. This is an important finding to inform occupational health and safety, concluded the authors. Moisture retention, reuse of cloth masks, and poor filtration may result in increased risk of infection. And the authors added, as a precautionary measure, cloth masks should not be recommended for healthcare workers, particularly in high-risk situations, and guidelines need to be updated.
Let's talk about the air that we breathe. This is a little gadget we use here. I'm a union electrician, and sometimes we have to work in confined spaces. This gadget here will read whether or not the air that you're breathing is safe. Okay, it reads oxygen levels, carbon monoxide, methane. If the atmosphere you're working in a enclosed, in an enclosure, a confined space, is not safe. The alarm goes off and it will tell you basically get out before you die. All right. I'm going to hold this up in front of my face here a little bit, and it's fine. Nothing happens. The oxygen is fine. Everything is fine. Okay. Now, let's do this here. Let's put on a mask. Now we're going to take the oxygen, or the meter again. We're going to stick it just inside of the mask here. And let's see what happens. I'm just breathing normal. Oh my goodness. Look at that. Look at my oxygen levels. Now they want everybody to wear these masks all day long. Now, if this was happening on my work site, we would have to get out of the confined space immediately because the air that we're breathing is not safe. So now you're going to tell me that wearing this mask all day long is safe? It is not safe for you. It is not safe for your children to wear that mask all day long. So I'm going to tell you what. Stick that up your fact checker, people.
I've been waiting to make a video so I can show all these masketeers how these don't work. I'm a painter by profession. If you see what I have currently on my face, this is an N95 respirator mask. Underneath that, I have another piece of cloth, as they recommended, double masking, right? Okay. See all this? Brought you a little black mask to demo on it. You see all that? Now, anybody that knows anything about viscosity knows that paint has a much higher viscosity than any kind of bacterial infection that's floating through the air, or virus, or whatever the hell they want to call it. If my mask won't stop latex paint, what the
Let's take a look at the experts making decisions about our health. These are the people we're trusting with our lives and the lives of our children. The CDC is not an independent agency. It's a vaccine company. The CDC owns over 20 vaccine patents, and it sells about $4.6 billion worth of vaccines every year, according to Robert F. Kennedy Jr. The CDC is also in bed with Big Pharma. The CDC gets millions of dollars annually from Big Pharma, and then turns around and recommends testing and drugs created and marketed by those same companies. And this is often done upon their contributing companies' demand. As the British Medical Journal reported, much of the funding from Big Pharma was conditional and earmarked for specific projects that turned out to be the promotion of the contributing companies' products. Let's take a look at some of the contributors to the CDC. See if there's any familiar names like AstraZeneca, Johnson & Johnson, Pfizer, and Merck. Merck is a funder of Moderna vaccine, so they're getting their money's worth there. The former head of the Food and Drug Administration is now on the board of Pfizer. If you do a Google search of Pfizer criminal history, this is what comes up. Pfizer has been a habitual offender, persistently engaging in illegal and corrupt marketing practices, bribing physicians, and suppressing adverse trial results. Since 2002, the company and its subsidiaries have been assessed $3 billion in criminal convictions, civil penalties, and jury awards. Let's take a look at the current FDA Commissioner, Dr. Janet Woodcock. It says here, some argue her past and current conflicts of interest and her inadequate oversight of the opioid crisis should disqualify her. It says Woodcock previously was the director of the FDA's Center for Drug Evaluation and Research, where she played a key role in the approval of opioids, including for children ages 11 to 16. Her tenure with the FDA coincided with that of Dr. David Kessler, former FDA commissioner. He was featured in a 2019 segment on CBS where he admitted that Purdue Pharma's opioid OxyContin was not originally approved for long-term chronic pain. 60 Minutes obtained a court order for documentation which revealed secret meetings between the FDA and Purdue Pharma, after which the FDA bowed to the drug maker by choosing to ignore the lack of scientific data and allowing OxyContin label to read around the clock for an extended period of time. According to 60 Minutes, one internal document revealed that Purdue Pharma was jubilant about the labeling change, saying, "The action by the FDA has created enormous opportunities to expand the market." Purdue's sales tripled. Johnson & Johnson had a run-in with the Department of Justice too. They had to pay more than $2.2 billion to resolve criminal and civil investigations. Allegations include off-label marketing and kickbacks to doctors and pharmacists. Here's AstraZeneca had a $520 million fine for off-label drug marketing. And this one's about Moderna. Officials probing if Moderna vaccine linked to a higher risk of heart inflammation in young adults. And they did a report. Now this one's really important because of this proposed vaccine mandate for young children that the president announced in his talk the other night. It says here, sources who spoke on a condition of anonymity said that the research shows a potentially greater risk of heart inflammation among Moderna than Pfizer-BioNTech recipients, most notably for men under the age of 30. Now, if you really care about those who trust in you to look out for their best interests, you need to do more research on the dangers of masks versus the benefits. You'll find there is more chance of harming them with masks than protecting them from a virus in which they have a 99.9% survival rate, if they get symptoms at all. That's not hyperbole. Let's take a look at the CDC COVID data tracker. This is available on the CDC website and it's updated regularly. These charts here are from September 11th, 2021. On the left, you'll see cases by age group. On the right, it's deaths by age group. Now, when we go through this, keep in mind that cases don't necessarily mean hospitalization, death, or even symptomatic illness. As the CDC admits, they can't tell between COVID and influenza with the recent PCR test, and that's why they're going to stop using that. But keeping that in mind, let's give the CDC the benefit of the doubt. So if we look at the age group 0 to 4 years, the percentage of cases is 2.3%. The percentage of deaths is 0%. Age group 5 to 11, 4.7%. Deaths, 0%. Age group 12 to 15, 4% cases, 0% deaths. Age group 16 to 17, 2.7% cases, 0% deaths. Age group 18 to 29, 22.4% cases, 0.6% deaths. That age range covers pre-K through college students up to 29 years old. Where's the logic in imposing a proven health hazard into their development? Look at the players promoting vaccines, testing, and masks. Can you see the conflict of interest and the lack of ethics and empathy for the people that are harmed by their profit-motivated mandates? It's hard to imagine critically thinking people believing that criminals can conjure up a safe vaccine in 8 months. Children are being harmed every day that we allow these suspicious CDC mandates to stand. We need to start a dialogue, free of censorship, politics, and egos. I have information that I can share with any committees formed to research this further. I'm also available to meet with the school board or labor council to answer any questions or discuss information that counters what I've presented. You have my phone number. Unions need to raise these concerns with their joint councils, state federations, and international union health and safety departments. I hope you'll share this with them. My email address will be in the description if anyone would like to contact me to get some more information out or express opposing views. Feel free. I hope this information was helpful, and I look forward to a discussion.